All right, so lastly but not least, Dr. Trooskin is going to talk about a provider network that NVHR, Advocacy Network at NVHR is starting up, and we look forward to working with them on this too.
Good morning, everybody. Today I'm here to talk to you all about the National Viral Hepatitis Roundtable. NVHR, for those of you who don't know, is a coalition of over 500 stakeholders. NVHR has recently been sort of reimagined. It has a new home at HEP, the Hepatitis Education Project, and it will be located, though, and led by Lauren Canary. Lauren, where are you? There she is.
Yay.
In Washington, D.C., so very close to the policymakers. And the work that I hope to assist NVHR with is really to essentially create more cammy-grams, and impossible, really, but to really try to support providers to do some of the work that you heard her describe. I know providers are really busy, but we're actually natural advocates. We advocate for our patients all the time, whether it's a peer-to-peer or talking to a consultant and advocating for the care that you think the patient should or should not be receiving. And so I want to provide support to providers who think that they may not have enough time. And these are all simple things that we can do. We can speak with legislators, we can call our Medicaid directors and advocate for patients that we think may have been denied if they still live in a state with restrictions. What NVHR really is planning on doing is creating a sort of cachet of support systems. So we're going to create a network of providers. We used to do this on a more sort of loose basis. We would have a quarterly call, which for providers around the country was often difficult to put into their daily patient schedule. So we're going to create a Slack channel so we can communicate with each other in real time. There'll be a repository of draft legislation, of budgets to help with lawmakers and prison systems. There'll be all kinds of appeal letters and things like that we can do to support providers so nobody has to reinvent the wheel. And most importantly, we want to connect you with each other and also with patient advocates. So NVHR recently had a patient summit and is starting to train patients as well to be advocates and give them the tools and the forum that they need so that their voices are heard. And if we can combine patients with providers, we believe that we can lead this charge to eliminate viral hepatitis, both B and C. And so what I'd encourage you all to do is to go to voices4, the number 4, hep.org, and let us know that you're interested. And we'll reach out to you all and start to bring you into this community. We also want to hear from you about what you feel you need.